Joining us today is Professor Tim Hallett to speak about public health in low and middle income countries. Thank you for joining us.
Thank you.
You have looked at public health issues in low income settings. What are some of the wider public health implications of COVID-19?
Well, there's obviously a lot of concern about the spread of COVID-19 so far in the high and middle income countries. But you're right, the other real worry is what will happen in low income countries. It could be that the COVID-19 epidemics have a greater impact there because, well, one, there are more underlying untreated conditions, which could mean that more infections result in serious conditions developing. Two, it could be that there's less opportunities for control. There is more crowding in urban settlements. In many places, simple pieces of advice like to wash one's hands for longer are hard to do. There are larger households with multiple generations living closely together, and the cost of missing a day of work through staying at home, for instance, would be unsustainable for many people. And third, it might be that the capacity for surveillance of the epidemic in order to guide a response to it is more limited. So these will be issues that WHO, Africa CDC, and many others, will be and have been working very hard to address.
So what you've described are direct effects. Would you expect to see any indirect effects as well?
Yes. And in fact, these could be, another very big issue, actually. When an epidemic would come through a low-income setting, it might be that people with serious conditions already become less likely to receive the care they need, either because the health system capabilities for servicing those needs have been displaced by the demands of responding to COVID-19 cases, or maybe people themselves become disinclined to seek care or attend medical facilities whilst the epidemic is ongoing. And also, the expansion of the control measures that are needed to, bring down other infectious diseases all the time are likely not going to be possible at this time. And so we might see, very unfortunate resurgences of other infectious disease epidemics. That kind of effect actually has been seen before. There was the Ebola epidemic in Guinea, but looking back at that year, it seems like more people died of malaria that year than previous years, which is probably due to less treatment for malaria having been administered. And in fact, that increase in malaria deaths may actually have exceeded the deaths that were caused directly by Ebola.
Is there a solution for that?
Well, the solution people talk about is health system strengthening, which is making sure that the health system has the sufficient capability to respond to the many needs of the population it serves, as well as being resilient enough to cope with spikes in demand, such as can be generated through epidemics, or indeed other kinds of crises. So I think that's where people will be focusing.
Thank you so much for sharing your insights today.
Thank you.